Hello, good afternoon everyone. My name is Clara, I'm one of the physios at Wellness Embodied. Today we are going to be talking about headaches, and I'm going to give you a few tips of how to help you to self-manage your headaches at home. So first of all, what we should probably do is to classify your headaches. So this is mainly for people that are suffering from cervicogenic headaches. That means headaches that are caused by problems in your upper cervical spine. All right. However, if you are a migraine sufferer, or you've been never diagnosed, or you're not sure what type of headaches you got, you can try doing this. It's not going to do any damage to you because they are very safe and obviously are physio-guided exercises. But apart from that, maybe if you know you're suffering from headaches but you're not sure what type of headaches they are, maybe it's a good idea for you to see a health professional, as a doctor or a physio, that they can guide you a bit more and try to find the right diagnosis. But as I said before, this is mainly for people that have headaches coming from the neck, but you can give it a go. If it helps, great. If it doesn't, that's when you need to do a consultation. So to do a quick review of what a cervicogenic headache is, usually headaches, that means head pain, very related to neck pain. So patients usually complain of that the neck start getting tight, and then the pain start radiating up to the head. Sometimes we can also get headaches at the base of the skull, at the suboccipital area, or sometimes it refers and comes all the way up here to the head. The pain is not too intense, it's like mild to moderate, and it stays probably along the day, but it doesn't worsen at the end of the day. Usually people are suffering from migraines, the symptoms are worse at the end of the day while they continue doing their daily life activities. People with cervicogenic headaches, they tend to be able to continue with the daily life activities despite of having that constant pain. All right. And another important thing is it's not a throbbing pain. Okay, it's just constant there and very related to neck pain and neck tension. All right. So what do we do for this type of pain? Okay, as we say, it comes from the neck, so that's what we're gonna go on treat. Yeah. So in the upper cervical spine, this is the base of your skull, and these are the three first vertebrae. All right. So usually when we have a headache, it can be related to a bit of compression between those vertebrae, compressing the nerves and making us feel very tight and giving us some pain. It could also be some muscle weakness that puts our vertebrae in positions that are not appropriate. It can be relating to the posture or the activities we do every day. It could be relating to the way we sleep. So there are many things that we need to start thinking, what do we do every day? Try to improve them and see if our symptoms change. If they do, it's because definitely it's coming from your neck. For example, we have a lot of patients that are probably working in an office, so they are sitting and typing on the computer all day. And we all know that at the end of the day, or after doing that for a while, we all tend to slouch our shoulders, all right? So that slouch posture will bring your shoulders forward, and that will bring your neck forward and your head forward. So look, this is on the side how it looks like. This is what we do, all right? And we keep typing. Look here, look at my cervical spine. The space there, the space between my skull and my upper vertebrae is reduced. We're putting compression there. And that's when the nerves get a bit upset, when the muscles get tired and sore, and that's when we start having pain. So first thing you need to do, if you suffer from cervicogenic headaches and you work in an office, check how you're sitting, check how your desk is. We did a video a few weeks ago about ergonomics in the office, or if you're doing home office. Very important to check that, because think that you're sitting for probably 8 hours a day. So that's probably one of the reasons why you're having so much headache. So if you haven't seen that video, write down a message, let me know and I can send you the link and share the link with you, because it's very easy to do, very specific, and it's very helpful. We need to change and modify your activities to try to change the symptoms. I'm a physio, I can do hands-on treatment, but to think that this is something that you need to be doing every day to try to decrease your symptoms and the frequency of your headaches. So it's not everything up to the physios. You should be part of your treatment. You should be trying to find out what's causing your problems to try to decrease those symptoms, okay? So first thing, if you're sitting or spending a lot of time on computer or sitting, you need to check that and try to modify that. Next thing to do is to get some movement happening in your upper cervical spine, all right? So we say we have nerves coming up here, and those are 3 very important joints that are working all the time to keep our head straight. So when we have pain, we have muscle stiffness, and the joints can get a bit stiff as well, and we lose the movement. So I'm going to show you a very good exercise that you can do it when you're sitting, when you're driving, when you're standing, everywhere. Very easy and very effective. So let's start to do something. I'm going to be showing you exercises, but first I want you to check your neck movement to see if before and after these exercises you notice any difference. So we're going to turn our head to the right. I can feel some tension here on my left and to the left. Okay, when I go to the left, I feel pain in like my shoulder blade. So I'm going to do these exercises and think that helps me. First exercise, cervical spine retractions. This is going to help us to get some range of movement in our upper cervical spine. When the joints move free, everything gets happier. Your muscles get happier, your nerves get happier. So first thing to do, get moving, okay? So how is this exercise? You are sitting, relaxing. You can do it standing as well. What you're going to do is do a horizontal movement of your head, forward and backwards. I'm not going to be doing yes and no. So my chin is going to stay in the same plane, and I'm just going to move it forward and backwards. Chin out, chin in. Look, you see that double chin there? That's what you're looking for. So I'm not saying yes. I'm not saying no, not lifting my chin up. I'm just moving in a horizontal plane. Okay? Something good to do is with 2 fingers, you push a bit further to achieve better range of movement. So if you feel the end that you cannot move anymore, you push a little bit more. So you get more movement. And you're going to do that 10 times. So that's 2, 3, 4, 5, 6, 7, 8. I show you on the side so you can see my head, my chin movement, right? So 1, 2. Yeah, so my head is moving back, forward and backwards. I'm not doing this, okay? Remember that. 10 repetitions. Once a day is fine. If you are in the office, you can do it. If you are driving your car and you realize you are slouched like that, you can do it. If you realize your tension isn't starting and your muscles getting tired, you can do it. The more you do it, the better. But with 10 repetitions a day, it's fine. All right? So that's the first exercise, is getting some neck range of motion. Next exercise, pretty easy to do. We can do it as well sitting, standing, or lying on the bed. What we're trying to do is target the mid and inferior trap. So the upper trap is this muscle here, this one here, that comes all the way up to your head and goes down to your shoulder. That's the muscle that we all, when we have tension, we all feel it gets tight. So that means because that muscle is all the time active. So what do we want to do? We don't want that muscle to work anymore. It's already working. So we're going to use the muscles that do the opposite action to the upper trap. That's the mid trap and the inferior trap. Where do I find them? Between my shoulder blade here and a little bit under my shoulder blade. It does like a trapezium shape. Yeah? So those are the muscles that we need to target. When we use a muscle opposite to the one that is tight, the tight muscle will relax, okay? So if we use the other muscles, the upper trap will relax, all right? So how do we do that? We can do squeezing our shoulders back and bringing down towards your pocket, all right? So your scapulas, that are these bones here, are gonna go towards the middle line, towards your spine and down, yeah? So I always tell my patients, think of squeezing your shoulders back and bring them towards your back pockets. Alright, so you bring them towards your hips. So squeeze and down. You can hold for 5, 4, 3, 2, 1, and you release. Remember, I'm not doing this, I'm not bringing extremely back. It's just squeezing the shoulders back, simple as that, and down. And hold it for 5 seconds. And you relax. Look, the movement I do in my shoulders is a tiny movement. Alright? So I squeeze my shoulders back and down. Nothing crazy, not overreacting, not lifting your shoulders towards your ears. Alright? Good. How many times? Again, you can do it 10 times. And you will notice a difference, alright? We are helping the upper traps to relax. When you relax the neck muscles, that will give more room to your joints to move a bit better. Good, very good. So we do that 10 times, again, sitting, standing, or if you're lying on your back, even better, because when you're lying on your back, all your neck muscles are relaxed. So that's very good as well. Or even lying on your tummy. I give this sometimes to my patients who do it lying on the tummy. It's a bit harder, but I think probably if you're in bed, you can do it lying on your back, neck muscles are relaxed, and that's very good. If you're in the office, if you're at work, if you're doing activities at home, you can do it while you're cooking. Anything. Very easy, very simple to do. Next exercise, stretching. Very important to get some stretching. The stretching also helps to relax the muscles, alright? When we stretch, we need to make sure we're feeling that it's stretching, nice and gentle. We are not causing pain. It shouldn't give you pain, just a stretching feeling, alright? So we bring hand, like we grab the bed or the chair, wherever you're sitting. So we're gonna be stretching my left upper trap. With the opposite hand, you're gonna grab the back of your head and you're gonna turn your head to the right and down so you can look towards your hip. So it's like a diagonal movement of your head. And you have some rotations or some bringing the chin up like that. Where do I feel the stretching? Here, upper trap again. How long do I hold for? 30 seconds. Do I do bouncing to see if that's stretching? No, that's bad. Every time you bounce, you're producing more contraction. We're trying to relax the muscle. So just find the limit, find when you feel stretching, you stay there and you hold for 30 seconds. And then we finish. I'm doing everything right because I want to show you guys after the exercises if there is any change in my neck movement. So you see I'm not lying and it's effective. Good, very good. All right, and then you do the same on the other side. Oh, I really need that one. So hand grabbing from the chair, so that brings the shoulder down. Then opposite hand grabs from the back of my head and I bring my head towards my left ear towards the left shoulder, a little bit down, and I look up that way. Good. So easy to do, we can do it everywhere. 30 seconds is nothing. So if you do 30 seconds on each side, it's 1 minute. How easy is that? And you can do it you don't need any elements, any equipment. Easy done. Good. So that's upper trap stretch. All right. Very good. Very effective. Again, getting movement, getting the muscles to stretch, so that releases the tension and the compression we're suffering on our cervical spine. Next exercise is similar. So this one I'm going to do it lying down, because we need the muscle. We're going to be training the deep neck muscles. Yeah. So you see this muscle here that you can grab. Usually people that have headaches have a lot of tension in that muscle. It's very tight. You see how I can grab it? That's the muscle there. All right. So that muscle gets very tight. It pulls like that and brings my chin out and puts compression on my cervical spine. So I want that muscle to be off. How do we do that? Lying on your back. Yeah. And when you're lying on your back, you're gonna be doing chin tucks. Same way that you were doing this one, but just doing a little contraction, not going all the way in, nice and gentle, and making sure this muscle is not working. So I show you. You're gonna lay on your back. Yeah, lying on your back. You make sure with your hand that this muscle is relaxed. So you hold your hand here around your throat. You touch the muscle and you do chin in. This time it is like saying yes. Hold for 5 seconds. If you can hold for 10, it's even better. And you relax. When do I stop? As soon as you feel you're using that muscle too much, means you're going too far. You don't need that muscle to be working. You want it to be nice and relaxed. So don't move your hand from that muscle. Good. Chin in, hold, and you let it go. Chin in, hold, and you let it go. I'm doing 5 seconds holds, but 10 is better. Good. So this one again, you can do it in bed before you go to sleep or in the morning when you wake up. Very easy. Good. How many reps? You can start with 10. If you can do 10, great. If you can do 5 only, you do 5. All right? Easy. Now that I just mentioned the bed, that's another important thing that you need to be checking. Sometimes these type of headaches are caused by the way we sleep and the amount of hours we sleep. A lot of patients suffering from headaches don't get enough hours sleeping, and sometimes it's because of stress or even drinking a lot of caffeine. So if you're finding you're suffering from headaches and you're not getting enough hours sleep, think, how many coffees I'm having per day? Are they double shot? Am I having any coffee after 12 o'clock? Simple things like that will change the way you sleep. And it's very important to get a good sleep to alleviate all the tension on your head. Then, pillows. Pillows sometimes, if the neck is in not the right position and we are, especially if we sleep on the side, are a big factor for headaches and causing neck trouble. So check on your pillow. Is it too flat? Is it too high? Am I using 2 pillows? How I wake up? Do I wake up with neck pain? Do I wake up with jaw pain? Maybe it is the way you sleep in them. So what pillow should I choose? It shouldn't be too hard, too soft. It should be something, ideally if you're sleeping on the side, that is the same height from your ear to your shoulder, all right? So if the pillow is too flat, that means it's like this thing. When you lie on the side, look at your neck. There's getting a lot of compression here, and obviously it's not gonna be happy. If it is too high, that means it's higher than the distance between my ear and my shoulder. You're gonna be sleeping like that. Look at my shoulder, my neck here, and my neck here. Unhappy. So that's the ideal pillow. That should be the high of it. So check on that. Pay attention. If you wake up with a lot of neck pain, it might be due to the way you're sleeping, or sometimes you're sleeping with a lot of tension as well. So doing some breathing exercises, stretching exercises like I show you, doing all these exercises before you go to sleep will help you to relax a bit more and sleep a bit better and wake up with less pain, okay? So stress, big factor We all tend to squeeze our teeth, grind everything, tense every single muscle, and then instead of sleeping, we wake up more tired. So very important to check the way you sleep and try to find tools, exercises to help you to relax before you go to sleep. And then the last tip I would like to give you is about supplements. We offer migraine care. So migraine care is from Bioceuticals. It's natural supplements. Bioceuticals are only sold by health professionals, so that means it's evidence-based and very good. Why is this good for you? Because the researchers have found that patients that suffer from migraines have a reduced, so on the test, they have low vitamin 2 and magnesium, and coenzyme Q10. So all those elements are very important for the normal functioning of our cells. So they found a lot of people suffering from headaches have low number of these elements. So that means probably giving them those elements will help them to reduce the pain, and actually that's what happens. So finding migraine care that has magnesium, vitamin 2 and coenzyme Q10 can also help you in a natural way to reduce the symptoms. So that's very good as well. So yeah, migraine care by Bioceuticals. I show you there. Perfect. Alright, so those are, I show you exercises to get range of movement. I show you exercises to use your muscles to get blood flow going, so that helps you heal. I show you exercises to stretch your muscles and help them to relax. I gave you exercise options to do it sitting, lying down, standing. And I also give you tips for your pillow, for the way you're working or sitting if you're doing it for too long. And I gave you a good supplement that is very important to get you feel better. So I think it's a good, very good, effective half an hour. So now what I want you to do is reassess your neck. So let's do a head turn. You won't believe me, but I'm not joking. I said I had tension on this side when I was turning that way. I promise you I'm not lying, I don't have it. And then I also say when I turn to the left, I have pain in my back. Let's see if that happens. So I don't have it, I promise you I don't. I'm not lying. I'm not trying to sell effectiveness. I'm a physio, so I can't lie. I promise you it's very good, very important, and let me know how you go. Let's just do them. Do 10 repetitions of each. Assess your neck before and after. Yeah, you can turn your head to side and ear to shoulder and check for yourself if it worked. Please comment below if it worked, and if it didn't, comment as well. But I'm sure it's gonna work. But let me know if you did it and if it was actually useful. And also, if you guys want to check the video of the ergonomics for your desk, I can also share that with you. Just right below. Thank you. Have a good day.